is Teresa Scott. Today we're going to be doing a physical assessment. I have here with me Stephen Scott. He's going to be my participant today. First thing to do whenever doing a physical assessment, you always want to wash your hands before entering the room. And once washing your hands, you want to explain to the patient the importance of washing hands, which is to decrease the transmission of bacteria, which prevents infection. Then from there, I go into the patient's room. I identify myself to the patient. Hello, my name is Teresa. I'm going to be your nurse today. Today we're going to do a physical assessment. It should take approximately 25 minutes or less. Within the physical assessments, you're going to be asked to stand, sit, just some different variety of positions, lie down. And then just want to let you know that the physical assessment is privacy. We're going to maintain privacy and it's confidential. And if you have any questions about the physical assessment, feel free to ask me. And I also want to identify level of consciousness. Mr. Scott, can you please state to me your full name?
Stephen Scott.
Okay, can you tell me what today's date is?
Today is February 22nd, 2016.
22nd?
Yes.
Are you sure? Okay. Can you tell me what year it is?
2016.
Okay, where are you at? What's your location?
Bryan, Arkansas.
Okay. Can you tell me why you're here now?
For a checkup.
Okay. Patient is alert and oriented times 4. Next thing to let you know is, next thing on our list will be vital signs. In this scenario, vital signs would already be taken, but your vital signs, blood pressure was 126 over 88. That's within normal limits for you. Heart rate was 82, which is regular. It's also within normal limits. Respiration was 16. Normal is 12 to 20, so that's good. Temperature was 97.3. That's also good. Now, Mr. Scott, are you in any type of pain before we begin?
No.
Okay. Level of pain is 0 out of 10. Now, just to let you know, as we go through the assessment, if you do feel like you're in pain, feel free to stop me and let me know, and we'll go from there, okay? So after completing the vital signs in the introduction, next thing you want to do is start the actual physical assessment. Now, Mr. Scott, the first thing I'm going to do is assess your scalp area. I'm just going to look at your scalp just to make sure. I'm just checking for no lesions, no type of dandruff, parasites, or any of that, no open wounds, in which I don't see any. Your hair is evenly distributed towards the front and the back and on the sides, but I notice some thinness in the middle. The color is black. It's kind of dry and it's kind of kinky, curly like. Okay, so once I complete, this head is rounded shape. It's normal cephalic, symmetrical. Once I complete his head assessment, next thing I want to do is move to his facial area. Now notice with the face, we want to make sure that we don't see any type of open lesions, wounds, moles, or anything of that nature. None in which I do see. His skin is warm to the touch, oily near the forehead area. Notice that everything is in alignment. The nose to mouth is in alignment. Do notice that he does have facial hair. He has a mustache and a beard, as you can see. And let's go further down. While I'm at the facial area, I'm going to assess his temporal pulses. Okay, his temporal pulses, both of them are equal strong bilaterally. Next thing we're going to do is move down further down the face. Looking at his eyebrows, I notice that they are both present, coarse, black in color. Then next thing I want to do is move on down to his eyes. Now with the eyes area, I'm going to grab my pen light and just as far as his eyes goes, we want to make sure that we look at the eyelashes. And I noticed that both of the eyelashes are present. They're everted on the upper and the lower lid. I want to make sure I checked his conjunctive, which is pink on both. Sorry. And his sclera is white. Also, color of his eyes is brown with both of them. His pupils are brown. Next thing I want to do is check his cranial nerve 2, which is optic. Well, let me first check the perla. Mr. Scott, I'm going to check your perla. And what it is, I'm just going to flash a light. It's going to come from each angle, and it's just me checking to make sure their pupils are equal, round, and reactive to light, okay?
Okay.
Okay, so his pupils are equal, round, reactive to light. And next thing I'm going to do is check your accommodation. What I'm going to do is I want you to look at me, and the next thing I'm going to do is I'm going to bring this pen light closer to your nose, and it's going to watch your eyes converge, okay? And that lets me know if your eyes are accommodating, okay?
Okay.
Okay. His pupils are equal, round, reactive to light with accommodation noted. So if moving from there, next we're going to test his cranial nerve 2, which is optic. And with cranial nerve 2, Mr. Scott, what I'm going to have you to do is I'm going to have you read what's on this card up here.
Okay.
First, I'm going to have you read it with both of your eyes. What does it say?
Lymph nodes.
Okay. Next thing I want you to do is I'm going to give you a card. There's a 3x5 index card, and I want you to cover one of your eyes with the card, okay?
Okay.
And when you cover one of your eyes with the card, I want you to identify the word that's on the board. And then we're going to do the same for the opposite eye, okay?
Okay.
So take this card. Make sure you close your eyes and cover it. Okay. What is this word?
Neck.
Okay. Now swap eyes. Cover. What is this word?
Head.
Okay. Mr. Scott correctly identified the words that were given, so his cranial nerve 2 optic is intact, as evidenced by being able to identify the words given. Now that we completed his cranial nerve 2, we're next going to move on to cranial nerves 3, 4, and 6. 3 is oculomotor, 4 is transducens, and 4 is trochlear, and 6 is abducens. And that's going to test for your EOM. What I'm going to do is I'm going to utilize my pen light, and I just want you to follow with your eyes only with my pen light, and that's going to be able to test for extraocular movement, okay?
Okay.
Eyes only, okay? Okay. Cranial nerves 3, 4, and 6 are intact. Next on the agenda, we're going to move down to the nose. When assessing the nose, we want to make sure that it's symmetrical to our face, is midline, symmetrical to the face, even in color. You notice any tenderness?
No.
No tenderness noted in that area. Next thing I want you to do, Mr. Scott, is I want you to occlude one of your nostrils and sniff for me, okay? And do the opposite. I'm just trying to make sure that you can breathe through your nose and make sure they're patent. So can you do that for me?
Mm-hmm.
Okay. Can you breathe okay through that?
Mm-hmm.
Use the other nose. Okay. There we go. So his nose, his ears are patent. No drainage. Mucus noted. Okay. At this point, we would test for cranial nerve 1, which is olfactory. And at this point, I will have Mr. Scott to close his eyes, and I will wave something underneath his nose so that he can identify the smell. But we're going to move on from that. Next on the agenda, we want to move down to his mouth area. As stated earlier, he does have a mustache, and he does have facial hair. So at this point, I want to look at his lips to make sure that they're in line with his face, which they are. Color his lips are symmetrical to his skin. Mr. Scott, can you open your mouth for me? I'm just going to look at your teeth real quick. I don't see any broken teeth, any cavities noted. Can you lift up your tongue? I do notice the hard and soft palate. Hard soft palate is pink. Hard palate, sorry, is pink. Soft palate is, you lower it down, is white. His mucosas, cheeks are pink and moist. Notice the rise and fall of his uvula. At this point, close your mouth. I'm going to assess for cranial nerves 9, 10, and 12. 9, cranial nerve 9 is our glossopharyngeal, and cranial nerve 10 is our vagus. And with both of them, cranial nerve 9, we assess for the gag reflex and the swallowing reflex. And with cranial nerve 10, we assess for the same, but we also assess for speech as well. And then with cranial nerve 12, which is hypoglossal, we're assess the movement of his tongue. So at this point, I'm going to assess Mr. Scott's gag reflex. So Mr. Scott, can you open your mouth for me? I'm just going to take this tongue depressor and put it at the back of your throat. It's going to make you gag. And that's the purpose of it, okay? Okay. Gag reflex is intact. Can you swallow for me? Okay, so cranial nerve 9 and 10 are intact. His speech is clear, as we can see. Next is cranial nerve 12, which is hypoglossal. At this point, I'm going to have Mr. Scott stick out his tongue straight for me. Can you move it side to side? Okay. Cranial nerve 12, hypoglossal is intact. Patient can stick out his tongue. Okay. And next from here, after we complete the mouth area, we're next going to move on to his ears. Now with the ears, we want to make sure that we look at the outside appearance as well as the inside. Notice on the outside, both of his ears are in line with his face. They're symmetrical. Any tenderness up here as I touch it?
No, ma'am.
Okay. I'm palpating his tragus. Any tenderness here? Mr. Scott, any tenderness?
No, ma'am.
Okay. Next thing I'm going to do is I'm going to look in the inside of his ear. Okay. I'm going to pull up and back since he's an older adult. I'm just going to check on the inside of it. Okay. He doesn't have any excessive cerumen. Notice in his ear. Neither with that side. No drainage or anything. Notice no tenderness. Notice on his tragus. Do notice that he does have piercing in both of his lower earlobes on both sides. At this point, we will test for cranial nerve 8, which is acoustic. And at this point, I'll do a whisper test. What I'll do is step 2 feet away from you. Mr. Scott, I'm going to whisper a word in your ear. And I need you to cover the other ear for me. I need you to identify the word that I whispered. I'm going to do the same with the other ear, okay?
Okay.
You can cover the other side. I'll start over here first.
Okay.
Okay.
Frosting.
Yes. I need you to cover that ear for me.
Snowman.
Cranial nerve 8 is intact, as evidenced by patient able to identify whispered words spoken. Now, after we leave the head area, we next want to move on to the neck area. In the neck area, we want to also look at his, the skin. Notice that the skin is symmetrical with the rest of his body. You also notice that he does have facial, not facial, but he does have hair present. Then also in the neck area, this is where we also palpate his lymph nodes. And at this point, I would like to do his cranial nerve 11, which is spinal accessory. And what I'm going to have Mr. Scott do is, Mr. Scott, I'm going to ask you to shrug your shoulders as I apply resistance to him, okay? Shrug your shoulders for me. Okay. Cranial nerve 11 is intact. Patient is able to shrug his shoulders against resistance. So now that we looked at the neck area, and also as I'm looking at it, we're going to also test range of motion. Mr. Scott, I'm going to ask you to bend your head forward, back, side to side. Okay. Any pain when you were doing that?
No, ma'am.
Okay. Patient has full range of motion in his neck. No audible crepitus noted. No pain or palpation. Next, I'm going to assess his, or palpate his lymph nodes. First one I'm going to do is his submental. Any pain?
No.
Next, I'm going to do his, submandibular. Mandibular. Any pain?
No.
Tonsillar. Any pain?
No.
Preauricular. Any pain here?
No.
Postauricular. Any pain?
No.
Parotid. Any pain?
No.
Okay. Occipital. Any pain?
No.
Okay. Next from here, we have the deep cervical lymph node, and we also have the posterior cervical. And with both of these, we want, I'm actually going to take this headset off. Is that okay?
Yes, ma'am.
Okay. What we're going to do is we want to palpate these two lymph nodes one at a time. So first I'm going to start with his deep cervical. I'm just going to go right here. I'm going to palpate it one at a time. Any pain here?
No.
Any pain here?
No.
Okay. And next we're going to do his posterior cervical. Hit down for me. One at a time. Any pain here?
No.
Okay. What about here?
No.
Okay. So we done completed the lymph node section. Next, before we leave the neck area, I also want to palpate his carotid pulses. And when we're palpating the carotid pulses, we want to make sure we also do those one at a time. Okay. Okay. Carotid pulses are strong, equal, bilateral. And I also want to make sure I check his thyroid to swallow for me. Okay. Now, after leaving the neck area, we then want to move down to the lungs. Mr. Scott, next phase of assessment is I'm going to assess your chest area. I'm going to listen to your front and your back of your chest as well as the sides, okay?
Okay.
Let's see. When we're listening to the lung sounds, we want to make sure that we get every portion of the lungs, and we want to make sure we listen to both sides at the same time, just to make sure that we get a good now Mr. Scott, I'm actually to take some deep breaths for me in and out, okay?
Okay.
As I listen to your lungs, okay? You ready?
Mm-hmm.
Breathe in and out for me. And out through your mouth, okay?
Mm-hmm.
Okay. Now I'm going to listen to the posterior portion of his lungs as well. I'm going to ask you just to turn sideways just so we can get a good picture of it. Okay? Sit up for me. Breathe in and out for me. Okay, Mr. Scott, I'm going to ask you to turn back around. At this point, I've auscultated his anterior and his posterior portion of his lungs. Next, I'm going to listen to his lateral lobes of his lungs. I'm going to sit down to do this just to make sure I'm listening to both sides at the same time. Okay, at this point, Mr. Scott, I'm going to ask you just to keep your arms loose. I'm just going to listen up here. I need you to do the same thing for me. Breathe in and out through your mouth deeply, okay?
Okay.
Breathe. Sorry. Breathe. Okay. I listened to Mr. Scott's anterior, posterior, and lateral lobes of his lungs. Lungs are clear, bilateral size AP and L. Broncho-vesicular sounds noted, which are normal. Next thing I want to do is turn from me, Mr. Scott, just turn this way. I'm going to check his chest expansion. And normally you do this, can you twist your body for me? Just sit, you can sit straight right here. Normally when we do this, you probably can't see before the camera goes, we want to place our hand back here and we just want to make sure that his chest expansion is symmetrical. And we would note that by me placing my hands here. I'm going to ask him to breathe deeply for me. And my hands should, both of my thumbs should spread apart evenly. Okay. Mr. Scott, I need you to breathe in deeply for me and exhale, okay?
Okay.
Ready?
Yes.
Okay. Chest expansion is symmetrical. Okay. Then after noting this, next thing we're going to do after completing our lungs and thorax section, our next step on the agenda is to assess the heart. Now, Mr. Scott, when assessing the heart, I just want to let you know that we're going to listen to your aortic, your pulmonic, or tricuspid, and your mitral. Okay? I'm going to listen to those first with the diaphragm of my stethoscope. Then next I'm going to listen to it with my bell of my stethoscope. And then I'm going to palpate your mitral or PMI area, okay? As far as the very card. Okay. Okay. As far as the landmarks of the heart, the aortic is noted in the second intercostal space, right sternum border. Your pulmonic is noted in second intercostal space, left sternum border. Your your Earth point is located in your third intercostal space, left sternum border, and your tricuspid is located in fifth intercostal space, left sternum border, and your mitral is located in the fifth intercostal space, left sternum border. So, now that we identified the landmarks, we're next going to move on to listening to them. Okay. Okay. With the mitral, you always want to assess that area for 1 full minute. Um, and then after we listen to it with the diaphragm or stethoscope, we then want to switch it over and listen to it with the bell of our stethoscope. And that's just to make sure that there's no murmurs present. Okay. Okay. After I completed listening to the landmarks with my bowl of my stethoscope, next thing I want to do is I want to palpate his mitral just to make sure that it's not bounding or anything. Let's relax. Okay, his mitral is non-palpable, which is good. Now after we complete the heart sound, we next want to move on the agenda to the breast exam. At this point, Mr. Scott, you can relax. With the breast exam, it's pretty much a self-breast exam. Are you familiar with it? Do you know what it is?
No.
Okay, self-breast exam is something that we always encourage patients to do whenever you're at home. The reason we encourage patients to do it because everybody knows that early detection is the best way to go. Because the earlier that the doctors can detect it, the more it increases your chance of surviving breast cancer if you have it. One way you do a self-breast exam is, like I always tell all my patients, try to pick the day of the month that you can remember. Most people like to remember the first day of the month, which is say for instance, the 1st of March. Some people find it better to remember the 1st of March. And also I always encourage patients to keep a journal. If you don't have such a good memory, try keeping a journal what you found. And also, best thing to do is, after you take a shower, 1st of the month, try doing the exam. And what you can do is, when doing the exam, you want to make sure that your top layer clothes is off. You just want to expose your upper body. And like to encourage patients to utilize the mirror. And what you want to do is you want to look at your chest and you want to look at the breast area. You want to make sure that both of them are symmetrical. Okay? You want to look at your nipple area and the areola. You want to make sure that they're uniform in color. Make sure the colors are the same. One should not be darker than the other one, and the other one's super light. As far as your nipples, you want to make sure they're inverted or everted, whichever. How it both needs to be the same. And you want to make sure you don't see any nipple discharge, drainage, or any of that blood drainage. And also you want to look at the breast area to make sure you don't see any masses, dimples, retractions, any of those things. And make sure that when you're palpating, you don't notice any tenderness, any hard lumps or anything. And always try to, whenever you're doing your breast exam, I try to tell patients that when assessing them, if I'm going to assess my left side of the breast, good thing to do is to put my hand back like this, and I'm going to palpate it in a circular motion. And I'm going to make sure I get underneath the axillary lymph nodes as well to make sure that I don't feel anything hard, any hardness or tenderness noted in that spot area. You want to make sure you do it vice versa for this side, palpating, and make sure you don't feel anything hard or tender on that side as well. And you want to make sure that you keep up with this and you do it once a month. Try to keep a journal to make sure you keep up with logging the information. And also when you're doing the breast exam, remember you're going to assume more than one position. You're going to be standing, sitting, and lying. So also keep that in mind. If you do find any abnormalities, contact your physician as soon as possible and try to get seen, okay?
Yes, ma'am.
Okay, so now that we completed our breast exam, the next thing on the agenda is our peripheral vascular assessment. And with the peripheral vascular assessment, Mr. Scott, what I'm going to do is I'm going to get you to lie back up. Get in bed for me and just lie back for me. Okay. What the peripheral vascular assessment is mainly wanting to assess for circulation. And what I'm going to do is I'm going to look at Mr. Scott's arms. Notice that the skin is symmetrical to the uniform in color to the rest of the body. It's warm to touch. I'm going to assess his nail bed. Okay, less than 3 on this side, scapulary field. Less than 3. The nails are clean, evenly cut. No clubbing noted. Next thing I'm going to do is I'm going to assess his radial and his brachial pulses. Okay. Give me this hand. Okay. His radial pulses is +2. They're equal, bilaterally strong. Next, I'm going to assess his brachial pulse, which is located right above up here in this section. I'm not sure you can see me in the camera, but I'm going to assess it here. Okay, I'm going to assess his brachial pulse right here. I'm going to assess both of them. Okay, his brachial pulses are equal, strong, +2. Amplitude is +2. Okay, now that I completed, well, before I leave this section, there's no edema noted up here. He doesn't have any edema noted in his upper extremity, no tenderness. Then I'm going to move on down, and normally I would palpate his femoral right here, but I'm just going to identify them for now because his pants. I'm going to ask you to uncross your legs. Next on the agenda will be the popliteal pulses, and it's kind of hard to palpate them because of the clothes that he's wearing, but I will feel behind his legs, right behind the kneecap area, and I will palpate them, both of them at the same time, and identify with the amplitude of it and if they're equal. And after doing the popliteal pulses, I will move down the leg area from his knee down. I would assess for any type of edema. Well, with these pants, it's kind of hard to tell, but as far as what I'm feeling, I don't feel anything. And after noting edema, I then would assess his posterior tibia and his dorsalis pedis, which is the posterior tibia is right behind the ankle area. Okay, for his posterior tibia and his left foot is +1 and his right is +2. So in this case, both of them are not equal, and that's the purpose of assessing both of them bilaterally. After I complete that section, I then move on down to his feet area, making sure to look at his toes, making sure that I don't notice that, make sure not to note any skin discoloration or any of that. And then I would palpate his dorsalis pedis. It'll be right up on the top part of his toe. I'm not sure if you can see me doing it. Palpate here and do the same, both of them. Okay. Same as the posterior tibia, his dorsalis pedis. Dorsalis pedis is +1 in his left foot and +2 in his right. Now, this completes our my physical assessment, but I want to go backwards for a second. You can sit up for me, Mr. Scott. As I was doing the assessment, I left off 2 of my cranial nerves, which is cranial nerve 5 and cranial nerve 7. Cranial nerve 5 is trigeminal, cranial nerve 7 is facial. And I want to make sure to assess those before I complete my physical. Now, Mr. Scott, with the cranial nerve 5 is trigeminal, and with this cranial nerve, I need you to close your eyes for me. And what I'm going to do is I'm going to touch on both sides of your cheek one at a time with an object, and I need you to identify whether the object is hard or soft and what side of the cheek I'm touching it with, okay?
Okay. Right cheek is hard.
Okay.
Left cheek soft.
Okay. Cranial nerve 5 is intact, as evidenced by a patient is able to identify between soft and hard object. Our last cranial nerve is cranial nerve 7, which is our facial. With cranial nerve 7, at this point, Mr. Scott, I would then ask you to smile for me. Okay, clench your teeth. And as you can see, I cannot pull his teeth apart. Raise your eyebrows. Okay, so his cranial nerve 7 is intact. And also with cranial nerve 7, we would ask patient to identify a taste of food, just to differentiate between his salty and his sweet taste buds. But at this point, we're not going to do that. And also moving back to the lungs, always palpate for tactile firmness. I didn't get a chance to do it, but when you're doing it, palpating across each lobes of the patient's chest as well as the back, and making sure, having the patient say the word 99, just to make sure you don't hear any extra vibration. But this concludes my physical assessment.